The 7 main vitamins that strengthen your legs. Imagine waking up every morning with legs that feel strong, firm, and full of energy. No more muscle weakness, no more painful cramps, and no more worrying about balance or falls. If you want to stay active, independent, and confident, the secret lies in nutrition. And today, we will reveal the 7 most powerful vitamins and minerals that will help you keep your legs strong and unstoppable. Have you felt painful cramps in your legs during the night? Or perhaps unusual fatigue when climbing stairs that used to seem easy? And that constant fear of losing balance or suffering a fall? If you are over 25 and want to maintain your independence, freedom of movement, and quality of life, this video is for you. Falls cause more than 100,000 hospitalizations in older adults each year in Latin America, and often, the cause is silent. A deficiency of essential nutrients that literally support our legs. Today, we are going to reveal the 7 most powerful nutrients to keep your legs strong, stable, and free of pain. From vitamins that strengthen muscles to minerals that protect your bones and joints, you will discover how small changes in your diet can make a big difference in your day-to-day life. Before we start, tell us in the comments, from which city or country are you watching us? We want to know you. And of course, give this video a hand like, share it with someone who needs it, and subscribe to the channel. Activate the little bell so you don't miss any of the best health recommendations from our Salad 365 team. Join us on this path to a life with more movement, well-being, and freedom. As we age, our body undergoes inevitable changes. Muscle mass decreases, bones lose density, and simple tasks like walking or getting up from a chair become increasingly difficult. One of the main culprits, vitamin D deficiency. Various studies show that low levels of this vitamin are directly related to muscle weakness, loss of balance, and an increased risk of falls. But why does this happen? Vitamin D is not only key for absorbing calcium and strengthening bones, but it is also essential for muscle function. It acts as fuel that boosts protein synthesis and improves communication between nerves and muscles. This process is vital for maintaining strength, balance, and a quick reaction to any loss of stability. Did you know that it is crucial for preserving fast-twitch muscle fibers? These fibers are essential for reacting in time to a fall. Without enough vitamin D, these fibers weaken, leading to slower reflexes, weaker muscle contractions, and a greater risk of injuries. In addition, vitamin D helps reduce inflammation in muscle tissues, alleviating chronic pain and stiffness that many people experience in their legs. If you suffer from frequent cramps or inexplicable discomfort in your legs, adjusting your vitamin D levels could provide significant relief. Why is this vitamin deficiency so common? With age, our skin loses efficiency in synthesizing it from the sun. Added to this, many older adults spend less time outdoors, whether due to physical limitations, lifestyle, or fear of sun damage. But there is good news. The solution is simple and accessible. Get some sun every day. 15 to 30 minutes of direct exposure, preferably in the morning or late afternoon, can help you a lot. Try to expose your arms and legs to improve absorption. Include foods rich in vitamin D, such as salmon or sardines, eggs, mushrooms, fortified dairy, and organ meats like liver. Consider supplementation, especially if you spend most of your time indoors. The recommended dose for older adults is usually 800 to 1,000 international units per day. Although in cases of severe deficiency, higher doses may be necessary under medical supervision. Ignoring a vitamin D deficiency not only weakens your legs, it also opens the door to serious problems such as osteoporosis, fractures, cardiovascular diseases, and cognitive decline. That's why, if you want to keep your legs strong and your independence, vitamin D should be a priority from today. When we think of strong bones, calcium is the first nutrient that comes to mind, and rightly so. But what many don't know is that calcium is also vital for muscle function. Without adequate levels, both muscles and bones begin to deteriorate silently, directly affecting mobility, balance, and independence. Unlike those whose bones are still in constant formation and strengthening, older adults experience a gradual loss of bone mass. This makes them more prone to fractures, especially in the legs. Hip fractures, femur fractures, and microfractures in the lower extremities are some of the most serious and frequent injuries in old age. A simple stumble that might be harmless in youth can turn into months of recovery or even permanent loss of mobility. But calcium doesn't just strengthen bones. It is also a fundamental player in muscle contraction. Every movement you make, from lifting your foot to maintaining balance while standing, depends on the exchange of calcium between your muscles and your nerve cells. Without enough calcium, muscles can experience cramps, weakness, or a significant reduction in their resistance. And yes, one of the most common symptoms of calcium deficiency is frequent leg cramps. That sudden and intense sensation during the night, or that inexplicable fatigue after a short walk, can be a clear sign that your body needs more calcium. Variety is key. Incorporating multiple sources of calcium improves absorption and contributes to bone maintenance more efficiently. However, in some cases, food alone is not enough. People with dietary restrictions, digestive problems, or reduced absorption may require calcium supplements, especially when combined with vitamin D, which improves its absorption. But be careful. More is not always better. Excess calcium, especially from supplements, can cause kidney problems, deposits in the arteries, or digestive disorders. The recommended dose for older adults ranges between 1,000 and 1,200 milligrams per day, ideally from a balanced mix of foods and supplements, when necessary. When we talk about leg strength, most people think of protein, calcium, or exercise. But there is a nutrient that often goes unnoticed and is crucial for the proper functioning of the nervous and muscular systems: vitamin B12. This vitamin acts as a kind of electrical conductor, ensuring that nerve signals travel from your brain to your leg muscles quickly and accurately. Without it, muscles do not receive the correct orders, which causes weakness, lack of coordination, and a progressive loss of control over movement. One of the most common and often ignored symptoms of B12 deficiency is the feeling of heavy, tired, or numb legs. Have you ever felt that your legs don't respond as they used to when walking? Or that you find it hard to maintain balance for no apparent reason? Many times, this is not due to age, but to a B12 deficiency. The problem is that deficiency of vitamin B12 is extremely common among older adults. Why? Because its absorption depends on a healthy stomach. To extract it from food, the body needs stomach acid and a special protein called intrinsic factor. As we age, we produce less stomach acid, and coupled with digestive problems like gastritis or prolonged use of antacids, B12 absorption becomes deficient. In addition, many older adults consume diets low in foods rich in B12, which further accelerates the process of depleting this essential nutrient. Especially when the deficiency is severe or absorption is limited, periodic B12 injections are recommended by health professionals. Don't forget, strong muscles need effective nerve signals. No matter how much you exercise, if your nervous system is not working properly, your legs will not respond as they should. That's why maintaining adequate levels of vitamin B12 is one of the most overlooked but most powerful strategies for preserving mobility and quality of life as we age. Every time you take a step, climb stairs, or get up from a chair, there is a silent mineral that works tirelessly for your muscles to contract and relax properly: magnesium. Although it is not talked about as much as calcium or vitamin D, magnesium is essential for muscle function. It regulates the transmission of nerve impulses, balances calcium and potassium levels, and prevents muscles from contracting involuntarily. In fact, one of the most common symptoms of its deficiency is nighttime leg cramps and restless legs syndrome. Have you ever woken up in the early morning with a painful contraction in your calf? Or at the end of the day, do your legs feel heavy, with spasms or without energy? That discomfort may be a clear sign that you lack magnesium. In addition to your muscles, magnesium also protects your bones and your joints. Although calcium usually gets all the attention, without magnesium, the transport of calcium in the body cannot be regulated correctly. This means that calcium can accumulate in soft tissues, such as joints or blood vessels, causing stiffness, pain, or circulatory problems. Studies have shown that older adults with higher magnesium intake have stronger bones, less risk of fractures, and better overall mobility. Even so, magnesium deficiency is very common, especially in older adults who take certain medications such as diuretics, antacids, or antihypertensives, which reduce the levels of this mineral in the body. In addition, chronic stress and a poor diet can rapidly deplete magnesium reserves, causing a progressive decline in energy, strength, and muscle flexibility. The impact of proper magnesium supplementation is surprising. People who previously felt slow and stiff discover that their legs move again with agility, that cramps decrease, and that even balance improves, thanks to a better neuromuscular connection. If you are looking for pain relief and more reactive legs, magnesium is your great ally. Imagine this. You wake up in the morning, take your first step out of bed, and suddenly, an intense cramp in your calf makes you stop. Does this sound familiar? This is one of the most common symptoms of a potassium deficiency, a key mineral for the proper functioning of muscles and for preventing painful, involuntary movements. Potassium regulates the balance of fluids inside and outside muscle cells, which allows muscles to contract and relax in a controlled manner. When potassium levels are low, muscles tense up uncontrollably, causing those annoying and sometimes incapacitating leg cramps. But cramps are not the only problem. Have you ever felt your legs tremble after standing for a long time, or that your muscles stiffen when walking, making you stumble more easily? All of that can be a sign that your body is not transmitting signals correctly between the brain and the legs, and potassium plays a fundamental role in that communication. In older adults, this imbalance can lead to instability, frequent stumbles, and an increased risk of falls. And as we already know, a fall in old age can change everything. Loss of mobility, complex surgeries, and a slow and painful recovery. In addition to its muscular role, potassium also protects bone density. It helps neutralize acids that accumulate in the body, which can weaken bones over time. That's why a diet rich in potassium not only prevents cramps, but also strengthens the bone structure of the legs, making them more resistant to fractures. Remember, it's not just about the muscles, but also about having the right fuel so that your legs function with precision. Potassium is that invisible fuel that protects you, stabilizes you, and keeps you moving. When strong bones are discussed, the first things mentioned are calcium and vitamin D. However, few know that without vitamin K, these two nutrients cannot do their job correctly. Vitamin K is like a traffic director, making sure that calcium gets where it needs to go, to the bones, and not to the wrong places, like the arteries or soft tissues. Why is it important? Because when calcium is not guided correctly, it can accumulate in blood vessels or joints, causing stiffness, poor circulation, joint pain, and even cardiovascular diseases. In contrast, with enough vitamin K, calcium is deposited where it is needed to strengthen your legs from within. Studies have shown that people with higher intake of vitamin K have denser bones, fewer fractures, and better overall bone health. This is because this vitamin activates a protein called osteocalcin, which helps to fix calcium directly in the bone matrix. But vitamin K not only benefits bones, it is also essential for joint and muscle health. It helps to reduce inflammation in the joints, which can relieve pain and stiffness, especially in the knees, a frequent complaint among older adults. Do you find it hard to get up after sitting for a long time? Do your knees crack or feel like they lock up when you walk? It might be that you are lacking vitamin K. In addition, this vitamin improves coordination and balance, especially in older adults, by regulating calcium levels within muscle cells. This helps maintain controlled muscle contractions and prevent clumsy or unstable movements that could end in a fall. Where do we find this powerful vitamin? In green leafy vegetables, spinach, kale, Brussels sprouts, fermented foods, such as natto, aged cheeses, and animal products like egg yolks and liver, which are rich in vitamin K2, a form that remains active for longer in the body and which is especially effective in fixing calcium in the bones. Important advice. If you are taking anticoagulant medications such as warfarin, consult your doctor before increasing your vitamin K intake, as this vitamin is involved in blood clotting and could interfere with your treatment. Including more foods rich in vitamin K may seem like a small change, but it can have a big impact on your stability, mobility, and quality of life. Strong legs are not just a matter of muscles. They also need dense bones, mobile joints, and adequate circulation. And all of that starts with a daily dose of this essential vitamin. While many nutrients are known for strengthening muscles or bones, few know that vitamin B6, also known as pyridoxine, is essential for keeping legs strong, active, and resistant to the passage of time. Why is this vitamin so important? Because it performs multiple key functions. It helps keep nerves healthy, collaborates in muscle repair, and ensures that the body correctly uses proteins to build and maintain muscle mass. Without enough B6, even seemingly strong muscles can lose effectiveness, energy, and coordination. One of the most overlooked aspects of vitamin B6 is its role in communication between the nervous system and the muscles. When B6 levels are low, these signals can become slow, confused, or incomplete, causing tingling, numbness, or a feeling that your legs don't respond well. Many people attribute this to aging, when in reality, it is a correctable nutritional problem. In addition, B6 is fundamental for reducing muscle inflammation, which improves flexibility and speeds up recovery after any physical effort. If you have noticed that it's harder to recover after walking, climbing stairs, or simply standing for a while, it may be that your B6 levels are below ideal. The recommended daily dose of B6 for older adults is 1.5 milligrams for women and 1.7 milligrams for men. Although it is safe to obtain it from food, supplements in high doses should be taken with caution, as prolonged use in excessive amounts can cause nerve damage. In summary, if you want to maintain agile, resistant legs, and an efficient nervous system, vitamin B6 must be present every day in your diet. Now that you know the 7 essential nutrients for having strong, stable, and pain-free legs, it's time to act. True prevention begins on your plate, in your daily habits, and in the commitment you make today to your health. If this video has helped you, give it a like, share it with someone who also wants to take care of their legs and their well-being, and leave us a comment telling us. Which of these nutrients are you going to prioritize from today? And if you haven't already, subscribe to the channel and activate notifications so you don't miss any of our health tips. Your independence begins with strong legs. Take care of them, nourish them, and move them every day. See you in the next video. See you soon, and have a day full of health and movement.